In my final year of my doctoral program, one has to complete a 1-year pre-doctoral clinical internship. And I was very excited to be the very first Canadian to be accepted into the clinical internship program at Harvard Medical School. So I moved to Boston and had my year there, which was a wonderful year. I loved Boston. And I conducted a mini postdoc over the summer afterwards. I was going to stay for a postdoc year, but then they cut all the postdoc funding after promising us another year. So we were all, well, 4 of us were going to stay on for another year. So we went scrambling. So I ended up moving to Toronto, where I conducted a postdoctoral year in psychosocial oncology research. And after that year, came back to Winnipeg and worked with the Regional Health Authority as Director of Corporate Research and Evaluation, but always trying to stay connected to psychosocial oncology research. And so I had, when I was working on my graduate degree, is when I was here at the Research Center as a student. When I came back to Winnipeg, I continued to work on projects with colleagues here at the Research Center, including Dr. Leslie Degner, who's now distinguished professor emeritus of the University of Manitoba. She's been my lifelong mentor in terms of my research and life generally. She's just an amazing, amazing individual. And in fact, she was inducted last year into the St-Boniface Research Hall of Fame, the first woman to be inducted. In fact, she was the first woman to be a distinguished professor at the University of Manitoba. So that kept, and my relationship with her and her encouraging me to stay in Winnipeg was very helpful. And then I applied for a Research Scientist Award from the National Cancer Institute of Canada, which I was fortunate enough to receive 8 years of funding from them. And that sort of secured my place in the Faculty of Nursing. And then a tenure track position opened up, which I was fortunate enough to receive. And that then expanded, I advanced through the ranks to full professor. And fortunately, while I'd been at the Faculty of Nursing, soon to now be College of Nursing in the Faculty of Health Sciences, we're supposed to refer to it as that. I think July 1 is the official transfer date. I've been working at Cancer Care Manitoba part-time as a psychologist in the Department of Patient and Family Support Services. And I was there for 13 years, and only last year did I leave that position, in part because I had received a research chair from the Canadian Breast Cancer Foundation, and then offered a visiting professorship at the University of Central Lancashire. So in meeting with my dean, wonderful dean, Bev O'Connell in the College of Nursing, she said, I know that you can manage it all your commitments to teaching and research with the Faculty of Nursing, your clinical work, your obligations to your research chair and visiting professor in the UK. But on paper, it doesn't look like you can do all of that. And you have an obligation to your research chair. So you can choose your clinical work or you can choose the visiting professorship. And what do you choose? Well, given that I don't have the energy that I had 13 years ago when I could manage a full-time job and a part-time job on top of that, I thought, well, the time has come that maybe I should just have a full-time job. But so I gave up the clinical position with some reluctance. And I do miss the patient contact very, very much.